I'm Sue Wicks and I'm the Telecommunications Manager for the Newcastle upon Tyne hospitals. We've got lots of changes in Newcastle. For a start, we're rebuilding most of the Royal Victoria Infirmary and hoping to move all the facilities from the General onto the Royal Victoria and some over here on the Freeman. We're moving into something that is going to be new and modern, so why not take the latest technology with us?
I'm Peter Beatty, I'm the IT manager for the Trust and I look after all of the network, servers and the IP side of voice. Traditionally there were a range of networks, one for voice, one for data, DECT, wireless, and IP has allowed us to bring them all together into one single infrastructure to manage.
We grew so much in Newcastle on each site that we couldn't take any more upgrades. So I think the Trust looked at it and thought to go for a whole new system, and they went for central operating, which was a tremendous saving at the end of the day. Obviously you have to spend at first the initial outlay, but instead of running 3 different switchboards, we were then running one. Right? And then the network points, you want so many in each room?
2 per day. It allows us to invest once and make sure that we deliver the right thing, a reliable thing, rather than having lots of bits of investment in lots of different networks. Certainly in the new build programme, everything is IP based, so that there's been a lot more involvement in terms of voice, obviously data, but other things like access, build and access control, CCTV, alarms. And with the moves of people, some of them will move 2 or 3 times in the course of the build programme, so we took the decision to implement voice over IP from the outset, that we give them an IP phone when they first move, and that phone follows them for the rest of their move, so it's only provisioned once rather than 3 or 4 times.
I think with the new system that we eventually got when we went central operating, we also brought on DECT technology. This is so beneficial because for years doctors carried bleeps. They now have the digital phones that they can walk around with. Going back prior to the system, people would get a bleep, they would have to run around, wait for the phone to be free to contact us to find out who it was. So it is a much more efficient service that we provide, and both to the public and to our own staff here.
So Debbie, are we busy today? Have we got any GPs on hold?
I'm Valerie Windle and I'm the Senior Patient Services Coordinator. I manage a team of 14 bed managers in the Bed Bureau, and between us we cover 2 sites, 24/7, dealing with emergencies, waiting list surgery, A&E department, which is at another site of the General. Communication is absolutely crucial. It's the key to everything we do. We're a large trust over 3 sites, and we've got to be able to get the correct information to the correct area. We've got to talk constantly between the Bed Bureau, the Patient Services Coordinators, the wards, myself.
Certainly as we move forward with new clinical applications which demand greater mobility, we'll grow a wireless network which will cope with voice over IP from the high path towers.
The Siemens solution here, helping Newcastle meet their challenges, kind of really breaks down into making communications work for the worker rather than force a healthcare worker to use things in their special kinds of ways. So it's all about openness, flexibility and actually adaptability, so you're not stuck in something you can't change. Primarily it's not just about cost saving and efficiency. Yes, that's important and that's why we're working with them. But this technology opens up whole new ways of doing things, radically different ways of working together, bringing together people in different ways and formats of understanding. It becomes a much more effective way of working.
I've got a brilliant relationship with Siemens. Everybody really is very helpful to us because some of the things you're asking for, you're not sure if you can have it, if the technology is out there.
We're very interested in what Newcastle is doing because it's making a very bold statement in what it's actually using communications and IT for. So in effect, it's really tunnelling through that cost structure of change. And the result is the implementations they're putting in for the new systems and services mean they can become much more radical and much more effective in their change programs than by doing small incremental change. In fact, it becomes cheaper to do radical change than doing lots of risky small implementations. And we think they're leading that whole proposition here.
The key thing for us is availability and manageability. It's a 24/7 environment, and we need to maintain that availability so it is available 24/7.
That delivery of open, flexible, friendly, easy-to-use services is what it's all about in healthcare.
I think at the end of the day, we are watching the money, and this is what it's all about, because that's where it goes back to the patient.